Good morning, everyone. Welcome to Duchess International Hospital. My name is Judith Gbadebo, and I'm going to be facilitating alongside Dr. Oluwagbemiga Durojaiye, who's with me here, on the topic the loneliness pandemic, the strain of lack of community on mental health. Thank you for everyone who is here right now. I know a few people have commented. Thank you so much for keeping to the time. Thank you so much. So I'll have my co-facilitator introduce himself, and then I'll introduce what the session is going to be about.
Good morning, everyone. I'm Dr. Gbadebo Durojaiye, family physician and geriatrician. I welcome every one of us to this webinar. It's going to be exciting. It's going to be interesting. I expect that we're going to learn so much from it, and then you'll find out that you are not alone. You are not alone. All of us go through one period of loneliness or the other. And then we just want to look at factors that might be contributing to it, and then how we can overcome and cope with loneliness, because it has implications both on our mental health and even our physical health. So we hope to learn a lot today. We also want to learn from you. So we'd like you to comment, to engage with us, and then we can learn from one another. And I hope and believe it's going to be an exciting time. So welcome, everyone. You are welcome.
So today we're going to be talking about the loneliness pandemic, the loneliness epidemic, sorry. Now, the strain of lack of community on mental health. And the reason we selected this topic is in line with the theme for the year 2025 for the World Mental Health Awareness Month, which is May. And the theme was community. And it's very interesting and very important that we pay attention to what lack of community has done to a lot of us. Physically, so in our physical health, we'll get information about that. We'll get information about how it impacts our mental health, and also what loneliness epidemic is about, and how we can then improve the quality of our lives from this information we've gotten, and how we can change the trajectory of our lives with the choices we're making moving forward. So you're all very welcome. So let's get right into it. And what we have first is something very interesting. I want us to look at the screen. Okay, we have some quotes, and I'll read out loud the quotes. We can just think towards what this quote means to us, right? What comes to our mind when we think about this quote? You can write into the comment section whatever comes to your mind, right? So we know what loneliness is we know that loneliness is a common feeling that many people experience. It's like hunger or thirst. It's a feeling the body sends us when something we need for survival is missing. And this quote was given by Dr. Vivek Murthy, the US Surgeon General. And he has spoken very extensively about loneliness. He has spoken in numerous interviews. He has published papers on loneliness. And he has talked very extensively about the pandemic, loneliness basically is at this point. The fact that loneliness is a global problem. And what then comes to mind is how something very vital for our survival as social creatures is now very much absent, right? And what then that means for every single one of us. Okay. Mother Teresa mentioned that she said loneliness and the feeling of being unwanted is the most terrible poverty. Now, this can seem very difficult and very hard to comment a session, right? But it's just to identify the gravity of what we are here to talk about today, right? Is to let us understand how important this discourse is, how important it is that we pay attention to our social networks, how we interact, how we connect, right? To understand that it's such a vital need. It's as vital as the food that we eat, okay? Is as vital as the water that we drink. Because the truth is, when deprived of social interactions, the impact on our lives is immense. It's huge. Okay? So, not to start on a damper note, okay? But that's the essential reason why we have this course, to make us understand the gravity of what we're here to discuss today.
All right. Thank you very much, Judith. So, if I may ask, when was the last time you felt truly connected? Because when we are talking about loneliness, it's an emotional feeling that you experience when you perceive that you are not getting enough, engagement, support, acceptance, from your social environment. So it could come as a form of acceptance in the first instance. Do you feel that sense of belonging? Do you feel that other members of that particular group, are interested in you? They are happy about you joining the group. For example, you just moved into another neighborhood, or you just got a new job and moved into another office, or you just got, maybe into another family. Maybe you got married and all of that and entered into another family. That sense of acceptance, when last did you feel that way? It could also come in form of recognition. Do they even recognize you as a member of that group? At times we feel as if we are all alone. Loneliness is not just in terms of number, in terms of being the only person in the room or being the only person at a particular place at a particular time. Once there's that disconnect, once you don't get to connect with people, then you begin to experience loneliness. So if I may ask for our audience, when was the last time you felt truly connected? Not just surrounded by people, but when last did you feel that sense of belonging? Anyone can please comment on the chat box. When was the last time you felt truly connected? Because we really want to connect with you this morning. We want to engage with you. So when was the last time you felt truly connected? I could remember about a week ago, while I'm waiting for our comments, about a week ago, I called one of my friends. We've been friends since 2001, 2001, And then after some time, we both got married, more or less. We didn't have time for ourselves. But we came together last week. We went out to a restaurant together. And then, before we knew it, we had talked for about 5 hours. It was a time to reconnect. So when was the last time you felt truly connected? Okay, thank you, Fiona. Fiona says, about 2 weeks ago, when I was visiting home, I felt truly safe. Thank you. And Nonye says, the last time I felt truly connected was yesterday when I saw a friend. All right. So, but I'm sure you've been living with other people. So why is it that you didn't feel connected with those people as much as you did when you went home for EVA and then also for Fiona, sorry, and then when you saw a friend yesterday? That tells us that loneliness is not just about being alone in a place, but when you don't feel a connect, when you don't feel accepted, you don't feel appreciated, and then you don't feel free to communicate. Loneliness also talks about probably not being able to be yourself in the midst of some group of people. The fear of intimidation, the fear of criticism, and all of that, not being accepted, being criticized, could also affect what we perceive as loneliness. Okay, so Sonata Francis says, what do you mean when you say truly connected? Well, I think those three things I've spoken about are, for me personally, that's how I feel connected. When I'm with someone or with a friend or with a group of people, am I accepted the way I am and not criticized and not, isolated, and I don't feel isolated. Do they accept me the way I am? Do they support me when I'm going through challenges? Are they there for me? As a family physician, there's what we call the family APGAR. It talks about, if we use it to assess, the normal APGAR is used by pediatricians to assess a newborn, to know whether that newborn is healthy or not, or are there challenges, maybe respiratory problems, or things that we need to do. Maybe we need to give oxygen and all of that. For family physicians, we also have a family APGAR. We use that to assess families, to know whether this family is dysfunctional or functional. Because when you don't get support from your family members, when they don't believe in you, when you have successes and they are not celebrating with you, when you have challenges and they are not identifying with you, they are isolating you, regarding you as a failure, or you don't belong here, you're the black sheep of the family and all of that. All of those things could push anyone into loneliness. I really want to read your comments. Someone says, I live in New York currently and often feel out of place. Yes, I can identify with you, Fiona, because, it's a new environment for you. Maybe you change the environment and then it takes time to make friends. And Ireyimika says, a friend visited me for the first time yesterday. I felt cherished. Yeah, that's what we are talking about, and connected. About being free, being yourself, and knowing that you won't be castigated, you won't be, heavily criticized or hated upon just because of who you are. So thank you all for your comments. I think we should move on to the next slide.
Okay. Thank you so much, everyone. I love the engagement. It's really, really beautiful to see. It's really beautiful to see how we are all engaging in the chat. And that's how we want it to be, right? It's really an interactive experience because, of course, we are trying to connect. This is a way to connect as well. And we are trying to learn how to better our interactions, right? And to now go deeper. Okay, we talked about what it's been for us like, right? How we felt connected in recent times. Okay, so Fiona mentioned not being in Nigeria, okay, and how it's been difficult to integrate. And a lot of us, even if we don't travel, right, even if it's a new workplace, even if it's adjustment to some kind of role we are going to be playing or we currently are playing, right, there's that loneliness that is happening. Okay, and what then is loneliness in the first place? Okay, loneliness is the feeling of disconnection. So someone asked in the chat something about, how do I know if I'm connected, something along that line. And, Doctor already went into detail about it, which he would go further in detail, moving forward. But what loneliness essentially means is that feeling of isolation, right? Disconnection. I don't feel aligned particularly. Because the truth is you can be around people and they almost speak a completely different language to you. They can be laughing, jesting about certain things, but you almost can't even process it. You can share something very deep to you, and how it's processed almost destabilize you from even sharing any longer, right? So it's not really about physically being alone. It's about feeling alone even in the presence of people. Sometimes when you're by yourself, but it just has that feeling of I don't feel aligned. I feel quite disconnected. There's a gap between how I want my relationships to be and how they currently are in the moment. Okay, so you can have, you might be someone who people would deem to be popular, so you're invited to this party, you're invited to that event, you're invited to speak in conferences. People see you as this person who is doing wonderfully. But deep down, when you get back home, there's that quiet, right? Or when you sit down in the audience, when you are sitting doing what it is you are doing, or you're partying, you just have that feeling of, I don't feel well connected, I don't feel loved, I don't feel seen, I don't feel cared for. That's loneliness. That's exactly what loneliness means. It doesn't mean people are not there for you. It doesn't mean people are not able to show up for you. But it just means you feel disconnected. Because even when you have loving family members, it's still possible that a person can feel disconnected. And what are the things that could make someone feel that way? Sometimes it might be, of course, we have different reasons. I will go much further. I don't want to start, going deep into that. But just understand if I feel disconnected, right, in the presence of people or by myself, I feel isolated, I feel misaligned. There's that feeling of loneliness embedded in that. In my social relationships, I don't feel like this is my desire, right? My actual relationships don't reflect where I want my relationships to be. So maybe I'm someone who would love, people to be there for me when I'm going through dark times, and also be there to clap for my wins when I'm going through, beautiful, exciting moments, right? But I don't have people to share that with, so I tend to go through those experiences alone. And then it makes you feel bad. It makes you feel disconnected. It makes you feel like although you are part of the social, crowd or the social context, you are not really part of it. That's where the disconnect really is. Then what's loneliness epidemic? Loneliness epidemic is more global, right? It's on a global scale. So it's where a lot more people are experiencing exactly what I just described now, right? So not just you, right? Someone in the US, someone in India, right? Someone in South Korea, they're experiencing exactly what you're experiencing. They're having these feelings of loneliness, feelings of social isolation, social misalignment on a grand scale. And it's not something that is very new to us because I'm very sure to some degree we can identify it in our context, right? Maybe in your community, you're able to see how you're not as connected as you used to be when we were younger, right? You know how when you were younger, the kind of friendships you were able to build that you didn't have to second guess a lot of things, you're not able to do those things again, right? A lot of things have changed. You almost feel like, okay, if I invest in this friendship, right? If I put so much effort into this friendship, to what extent is it going to be worth my time? Because after a while, I could get cut off if you simply have a conflict. And that's where the loneliness epidemic is, right? There's this hyper individualism. right? We have more individualistic thinking type of people. So people who think more about self, just what concerns me, what matters to me the most. Oh, how does this impact me? How does this look good for me? How does this look on my resume? Oh, how does this look on my feed? So how many people I take pictures with? Are they popular enough? Are they well connected enough? The things that shouldn't matter now matter. The things that never used to make any impact to social interactions, because they really and truly still don't make impact to the depth of what real connection is now what is the most important thing. And you can understand why that can cause a huge problem, right? The over reliance of what social media and technology for our connection. Can we talk about that? There was something I discussed with a few people around me some time ago. It was about a case I was working with, right? A case I was working with in therapy. And it was someone who was struggling at work, okay, due to this remote kind of process. And with remote work, there's the sense of isolation that we don't acknowledge. There's a sense of isolation that we don't pay attention to. It could be it could be as little as an exclamation mark put at the end of a sentence and you are having anxiety, which is essentially what the person was having at the moment, right? And why was he having anxiety? He was having anxiety because he wasn't sure, he didn't feel secure. He felt like most of the responses he was getting, meant like he was wrong. He was second guessing himself. He was struggling with self doubt, and it was even more heightened because you don't have that social context of I'm working with these people, I'm spending time with them, I'm able to see that they're happy with me, I'm happy with them, I spend time with them, and I enjoy their company. I'm able to pick up on the cues on this person is not so pleased. They are not very pleased with the work I submitted. There needs to be some feedback here that I need to look back on and work very critically on, right? This matters a lot more than I thought it did, right? There's no emphasis on all those things because the social cue part of it is gone because we've overly relied on technology. As much as this is a webinar, which is beautiful, right? We still need face-to-face interaction. We can't neglect the benefit of having those interactions, okay? Then there's also the economic disparity. The simplest way I'm going to say that is we live in Lagos, okay? Not everyone, okay, Fiona doesn't live in Lagos, but a lot of people, in the context of going out, you think about, oh, I want to hang out with my friend, and there's the economic aspect of things. You can understand that you have to spend money, right? And to what extent are people willing to spend money? Okay, to what extent are people willing and able to spend it? And what that means is they just neglect it. So instead, I'm just like, when I have money, then I'll post something, or when I have money, I'll go out with my friend, go to a restaurant with my friend. But does it really have to be those kind of settings only that will connect with people? We have to start rethinking what connection meant. Yes, we had connection in school. It was so easy because we already had the content. But now that we don't have that, do we have to now make it become a problem in our life simply because we don't have the construct that makes it convenient to have those socialization efforts, right? To make us socialize very easily. No, we can't neglect it because of that, okay? So let's accept and understand that loneliness is real. Loneliness is huge. It's a big deal. It's something to take cognizance of, and it's something that impacts us very seriously. And we're going to see more of that in the next slide, okay? So what are the things we talked about that, right? We talked about hyper-individualism, okay? We talked about over-reliance on technology and also economic disparity, right? For you, it might be that most of your social network or people currently are based in a different country, and it's very hard for you to connect deeply with them, okay? You might need to start building new relationships while engaging with the older ones in a different context, but make it more enriching. Okay, so that's about that. Let's move forward. So I hope now see in the global scale, right? Let's see how serious this thing is. Okay, 1 in 4 adults globally report feeling lonely. Let's pause for a moment and breathe on that thought. 1 in 4 adults, okay? So it means if you are in a group of 10, at the very least, 2 people are feeling lonely. Let's just think about that for a second. And now think about that across different countries all over the world. And what that then means for the importance of this conversation. Okay? On a global scale also, there are people taking action, right? Countries are taking action. And two major countries have taken action. The UK appointed the world's first minister on loneliness. For you to know how much this is an important subject, how it's become a problem that needs to be tackled, right? How it's become something that we need to take seriously. The US Surgeon General declared loneliness as a public health threat. Let's process these things. There's not too much explanation, it's just process what's really going on to bring it down rather than, okay, I'm thinking of India, I'm thinking of the United States. Here in Nigeria, how do you feel? A lot of us said when we felt most connected, in the past week, right? We wrote in the comments, and I'm so grateful that we did that in the beginning, right? Because now we can reflect on how important connection is and how very little of it we have, and how seriously it is to start taking it. Okay? Loneliness does not just hurt our feelings, it doesn't just make us feel sad, feel bad about things, feel hopeless, feel worthless. It shortens lives. Okay? It's a big deal. It affects the quality of lives. And it's a crisis that we can't afford to ignore any longer.
Judith, for that excellent session. So, how did we get here? You know, we have been talking about loneliness and what are the factors that contributed to us getting to this point where loneliness has become an epidemic. And from what you've discussed, I have been able to draw out some few things to say that loneliness also is in both quantity and quality. So if you don't feel that connection, either strong enough or have enough of it, you may end up developing loneliness. So there are a few factors. This is not exclusive, but this is just what we're able to put together. The first thing is urbanization. The world has become a global village. And we'll still talk about technology because it's playing a major role. There's a lot of competition now. There's a lot of comparison, because you go to social media, you see your friends put up a post, you can see your classmate is now a director somewhere, and whereas you are still managing, with a job somewhere, you're already feeling lonely. When next they call for a meeting, you might not want to go because you feel, wow, I don't meet up, with society. And then when we were growing up, talking about thought spaces, when we were growing up, I remember my parents used to host a lot of societal meetings in the house. My mom had a group, they called themselves circle. And what they meant by circle was circle of friends. When they see each other, they hug each other. Oh, circle, circle. My friend. In Yoruba, they say, ore me. The way they hug themselves and all of that. But we don't get to see that nowadays. I've never hosted a meeting, for example, in my house. So my children didn't grow up, seeing such meetings because that support group is no longer there, and she is very elderly now. And the people that are still surviving from that group, they are the ones that are still identifying with each other. They are the ones she can call because people of her age group are not really many anymore. But those are the people she can call. If anybody's grandchild or great grandchild is having an event, they will show up for themselves. The friendship they built since then, they are still getting that kind of support, till now. So there's lots of community and thought spaces. All we are doing now is go to school, go to work, and go back home. We are not having time to socialize and to interact with people. And then talking about social media, definitely, what thing social media has done is that you can be so near and yet so far. You can have a family sitting at the dining table. They are sitting very close to each other, but they are closer to the person on the other side of their phone. People, you can hardly have a me time or a family time. You're at home, they are still calling you from the office, they're still sending mails, they're still doing all that. In those days, whatever didn't come to your office physically before you left the office can't reach you. They have to wait till the next day. Or if you post a letter, you wait for 2 weeks before it gets there. But now somebody is calling you at 1 a.m. and they expect you to pick up the phone. You want to have a family time together with your family, and then, for us doctors, if a patient is calling you, I have this challenge, I have this other challenge, and all of that. So technology has brought in a lot of disruptions. And then definitely the COVID-19 pandemic, it got to a point we couldn't even touch each other anymore. We couldn't hug each other anymore. We couldn't shake each other anymore. And a lot of people died from depression and committed suicide just because of the COVID-19 pandemic. And shortly after COVID-19, everybody kind of has gotten used to, working remotely. They don't want to go to the office anymore. And there are a lot of things you learn from social interactions. Gone are those days when, all meetings are largely physical, maybe 99% are physical. You learn a lot from there, courtesies, exchanging conversations, starting up conversations, making new friends, and all of that, learning from other people's experiences. But now, everybody is working remotely. We couldn't even get to see each other. I could remember a video during the COVID-19 pandemic when a grandmother, I think, had COVID-19, and then the daughter couldn't really visit with her child. And then the grandmother was just looking through the transparent window and just waving at them because they couldn't join. They couldn't join. Thank you, Noye. You said realistically, what can the government really do? We'll still get to that because some of these problems are things that we should be tackling. Can we move to the next? Business is different from business. The world has become so busy now, so busy now. I give you a typical example of a young adult, newly married, maybe has a child that is working and living in Lagos. So you do 8 to 5, Monday to Friday. Saturdays are the times you quickly run to the market to restock for the family. You make your hair, the man goes to cut his hair, watches football with his friends, and all of that. Then maybe Sunday, if he's a Christian, he has to go to church. Your church members have been waiting for you and looking for you. All the meetings in this world that they wanted to have, they will make sure they hold you. So before you leave church, maybe you are leaving church like 2, 3 p.m. By the time you get home, you have to help with your children's assignment. Before you know it, is 7 p.m. and the cycle goes on and on again. So because of that, people are pushing away genuine relationships. They are pushing that to the background. Let me just meet up with my targets, meet up with the demands from work and all of that. And then definitely the economic crisis. More people have been pushed into the rat race. I used to tell people growing up, my parents will come, but we had a lot of interactions. We'll wake up in the morning, we'll have maybe family devotion, they will go to work, we'll go to school. They are back by 3:30, 4 p.m. I can't remember the last time I got back home at 3:30 or 4 p.m., in this generation, So they are back by 3:34, we interact till 7 p.m., they watch the news, and then we all go to bed by 8 p.m. So we have long times, but because of the economic crisis nowadays, more people have been pushed into the rat race. Everybody is looking for money. So even your free time, you're occupying it with an extra job somewhere, with an extra runs somewhere. People talk about side runs and all of that. And then another thing that has contributed to how we got here is, the lack of policies or poor policies. For example, I had a couple walk into the consulting room last week, and the wife just retired at the age of 60. So she's gotten used, the last 35 years, she got used to working, being engaged and all of that. So this is our first year, as it were, of being alone or being at home, having nothing to do. So that's a poor policy, and that's why you've seen the developed world, they have increased the age of retirement to 70, 75. Because what do people now do? People just resign or retire and then just sit down at home doing nothing. And unfortunately, at that age, most of the children will be out of the house already. In family medicine, we call that the empty nest syndrome. The nest is now empty because all the, the eaglets in quote, they've all flown out of the nest. So it's left with mother eagle and father eagle just alone at home. And then, God forbid, but if one of the spouses has a health challenge, then the burden further increases on the person. So nowadays, people are on their own. I could remember, over there in developed countries, they have senior citizen centers. There's a bus to come and pick you up at maybe 10 a.m. They allow you to sleep well. So you wake up maybe by 9, get ready. A bus comes to pick you, takes you to the senior citizen center. You learn a lot of skills, knitting, even technology, how to use WhatsApp. You play games, you win, prizes and all of that. They could bring children maybe from a nursery school to come and interact, with those people who probably be grandpas or great grandpas, interact with them. And then maybe by 2 p.m., they serve you lunch. And then maybe by 2 p.m., 3 p.m., they go to drop you back at home. So there are rooms and policies that allow people and facilities that allow people to interact. But over here, what do you have? You're on your own. OYO. If you just retire like that couple that came in, the woman has been feeling somehow, emotionally disturbed, feelings, having some lightheadedness, having some physical symptoms just because, she's at home doing nothing. So she feels lonely because she has retired from her work. So those are some of the factors that contributed to how we got here. Like I said, it's not exclusive. I'm sure there are still other points that we might come across as we move on.
You really flogged how we got here, and it's very interesting how this conversation is going. I hope we are learning a lot right now. I hope we are really picking things up because it's supposed to be a conversation where, at the end of this, you learn, you go back home and start thinking about the way you've taken your interactions. The way you've neglected some of your networks. Okay. So now, how does loneliness impact mental health? Does it even impact mental health at all? Does it have anything to do with your mental health? What does it matter, right? But yes, it impacts it hugely, actually, hugely. So the first way we're going to look at how loneliness impacts our mental health is the fact that loneliness has, of course, an impact on the aspect of your brain, okay, that is linked to well, so many aspects of your brain, essentially, so many hormones that are being secreted. You have so many aspects that the aspects that specifically are targeted towards pain and also danger, more like threat, right? Those responses are very tied and very closely knitted to the brain. Okay, you also have your mirror hormones, your mirror neurons also in the brain that has to do with loneliness, has to do with social connection. Now, if someone is lonely, how then does that affect their mental health? You know what loneliness does to your mental health? Because we already identified that loneliness is a disconnection, right? It's a feeling of misalignment. It essentially feels like a survival threat. It feels like my survival is threatened. And we established earlier that our social connection, our social interaction is just as important as the food that we eat. Just as important as our basic needs. So you think of your shelter, you think of your clothing, you think of the food you eat. You also have to think of the community. You have to also think of your social interactions. Because when it comes down to it, social support is huge for healing. It's essential for healing. And if we now lack that, right? If social isolation is the other way, right? You have social withdrawal, isolation as your go-to mode, right? What that means is you're going to constantly be living in a state of feeling threatened, right? Feeling like you are in survival mode. And what that will do is it will trigger your stress responses. Yes. Okay, and we all know what triggering your stress response is going to do to your mental health and your physical health. It's going to cause chronic inflammation. For your mental health, it's going to cause anxiety. So you just find that for some reason you just are panicking. You can't find a way to rest. You can't be still. For how long? When was the last time, if you want to think about it, when was the last time you felt still? You felt able to be still. Let's think about it. Okay? Where you were not in fight or flight mode. You could be working, doing your daily, duty, your due diligence, doing everything you need to be doing. But for some reason, you're not able to be calm. You're getting things done, you go home, you have headache when you wake up. You don't feel relaxed. You don't feel rested. That's stress already. That stress response is already triggered. Now, how does loneliness then play a part in this, right? There's something very interesting about loneliness and how it impacts us as human beings. Now, if you stay away from social interactions so long, right, it's very hard to integrate again. Now, it doesn't mean the skills cannot be learned, but it means that the soft skills that allow for social interactions to move very smoothly diminish in your, in your vocabulary. So, you being able to pick up on social cues, you being able to be empathic, you being able to have active listening and not speaking over people, you not being selfish in your interaction. All those things are what get improved the more you are exposed to social interactions, right? But what happens when you decide to stay away from people for whatever reason? So maybe you've experienced a betrayal in your life, you've experienced heartbreak, right? So some say you've been served breakfast, right? Whatever it is you've experienced personally, right? It could be you have a lot of negative thoughts around social interactions. And what then does that do? It puts you in a low mood. So you decide, okay, I want to stay away from people, I want to isolate. You're invited to things, you shut down those invitations. You decide that maybe not now, maybe it's not going to be very relevant to my life, or I don't like those people that are going to be there. You find some kind of excuse that makes it valid for you to avoid social interactions. But guess what? You would watch the stories, right? You will watch the status, you will see, the feedback, you will feel the FOMO. So that's fear of missing out. Sorry. I'm a millennial, sorry. Okay, so you feel the fear of missing out, right? You will feel that sense of, oh, I'm not part of this community again, right? It could be a circle of friends. It could be cousins that invited you to something. It could be a family gathering and you gave the excuse of, oh, I'm sick. But you know deep down that you could have attended, even if didn't have to be as active. And what that then does is it now puts you in a low mood. So it was self-inflicted initially, right? But now it puts you in a low mood, right? And when it puts you in this low mood, you don't have that interest in interacting even further. And this is the vicious cycle essentially, right? So now you don't have interest in further social interactions because guess what? The first time you use an excuse, you've taught yourself that, yeah, I can get away with this. But you're training yourself to constantly use more excuses to get out of things. That's essentially what's happening. And now you are furthering the isolation. The next time you see people, enjoying their time, people you love and love you, but you decided to step back, okay? The low mood sets in, okay? That constant isolation is there. You now start feeling hopeless, helpless, okay? This is the vicious cycle of how it can trigger depression, okay? Start now thinking negatively, oh, am I even wanted? Oh, am I even loved in this setting? Did they really want me here? Did they really invite me because they wanted to? You start thinking, ruminating on things that would never should have been ruminated on if you had just shown up. Okay? Or if you had simply asked for clarification. Because some things it might not be an invitation, it might be an interaction you had with someone. And during the course of the interaction, you felt something was said, maybe disrespectfully, or whatever it is, the way you interpreted it, and you never voiced out. You now isolate yourself from the person. You are losing this relationship as a result because you never spoke up, okay? And after a while, you now start feeling bad. Before you know it, you've lost a complete relationship or you've lost a group of friends, whatever that is. And in essence, it deepens your isolation further. And of course, more loneliness. You see the vicious cycle. You guys see it. It doesn't end there. And this is how it affects mental health. Because then you now have people coming to therapy, and those coming to therapy are even the ones that are brave, those are the brave ones, the ones doing the beautiful thing, right? But those who don't come to therapy, but you experience it, you keep quiet about it, but it furthers. Because one thing with negative thoughts, negative thinking, it spirals. It doesn't just end at the top where you just have that thought. No, it gets even worse and worse and worse and worse. Okay, so what loneliness does is it actually triggers the risk of clinical depression in itself. Okay, for some it will be anxiety. So now what that means is now because I've now stayed in this vicious cycle of loneliness for so long, when I'm now to be presented into a social setting, I'm feeling anxious. I'm now awkward. But you brought it on yourself. You see how it's a vicious cycle. And we have to be very, very intentional with whatever it is, whatever choice it is we're making. Now, there's also another way it impacts us, addictive behaviors. Okay? So when you don't have, that social network that, ease your stress, because you find that when you ask people who have addictions, why did you start? So it could be someone who uses cocaine, it could be someone who uses alcohol to cope. You hear them, oh, I use it to relax, right? It could be nicotine. So I use it to relax, right? It just gets my mind off things. I'm able to just get my mind off things. I feel more relaxed whenever I take it. But the truth is, yes, you might feel relaxed, you might feel hyper, you might feel energetic, you might be able to get things done, get tasks done, but it's essentially the void of something you are feeling. And that void is the social interaction, the true connection. Because we already established it's not just social interaction. That depth of connection that comes with feeling seen, feeling heard, feeling truly connected, you have that lost in your life. And what you are trying to fill it up with, you can fill it up with, some will fill it up with emotional eating. So you have binge eating, right? And then it can lead to an eating disorder. So when you are gaining weight, you now start to throw up, let's not make it graphic, right? Some excessive screen use. So for you, you might be addicted to social media. Because addictive behaviors are not just substance use, right? It could be social media you're addicted to. Yes, you find yourself, okay, 2 a.m. I'm still on TikTok. Okay, 3 a.m. I'm on LinkedIn, right? I'm on Instagram, I'm on maybe not LinkedIn, because LinkedIn they'll be sleeping by that
Can be
time.
hard.
At that point, I would like to believe that, right? But I might be on Instagram schooling, right? I might be on YouTube schooling. That's addictive behavior, and it's because there's a void there, right? And sometimes when you just sit still, like just drop the phone, maybe at that 1 a.m., just drop the phone and just think to yourself, what's going on here? You'll find that most times when we do school, right, when we engage in addictive behaviors of any sort, emotional eating, it could just be eating to just feeling something. There's something missing, okay? For you, it could be something entirely different, right? It might be you trying to distract your mind from a stressful event, because that can also be something that leads people into addictive behaviors. But for you, it might also be loneliness, and that's why you have to pay attention to it. When was the last time you felt truly connected? Yes, you laugh with people. Yes, you joke with people. You hang out with people. But when was the last time you felt truly seen? And is it now affecting you in other aspects of your life? Is it now affecting your well-being and the choices you are making for yourself? Let's not even talk about the loneliness of leadership, because that's a whole topic of its own, right? The loneliness of being a leader where you can't really share with people what you're really going through. You can't really open up about the pains you're going through, your struggles, the difficulty it is to lead, right? Everyone expects you to be perfect. And what that means is how you relieve stress. You can't relieve it in the context of where you work, or where you're leading, because you have to go out, someplace else to relieve that stress. And sometimes it can now be those addictive behaviors, negative coping strategies that will pick up as the way we are now going to engage. So you see a lot of leaders using cocaine. Yes, they have the means to, but in essence, it's detrimental to them as well. Okay, so it's very, very essential. And these are not things I'm talking abstractly. These are things I'm saying based on presentations. Okay, now also, like I said earlier, right? The more you engage socially, it helps you improve in your social skills, those soft skills. And part of the soft skills is emotional regulation. How you regulate yourself emotionally. So someone annoys you, you don't go into a fit, right? You don't go into a rage, you don't throw a punch at them. You don't give someone a big slap. You problem solve, you self-soothe. Maybe for you, it might be taking a step back. I need to take a break from this. But the only way you can know is because you've been in social settings. And what those social settings have taught you is that I've seen how different people have handled things. So you know how we mentioned how the brain, right, has its impact in loneliness and mental health, right? It's simply that mirror neuron, right? What it does is it helps with social behavior. So it helps us to observe how behaviors are happening and how we learn. So with social learning, right, it's more about imitation. So whether or not we like it, that's why we always say, it's said very popularly that we are the sum of the five people we spend the most time with, because we are constantly imitated, whether we are aware of it or not, right? And what that means is if you see someone who was angry and they caught their anger in a way, you learned it. You've learned a way to present yourself in a different manner from what you already knew, simply because you were in proximity to that person. You've learned emotional regulation by proximity, right? You've learned how to problem solve by proximity. So someone being around you, problem solving, doing things in a better manner, right? They were struggling with an emotion. You also struggle with, we all have emotions, right? We all have negative emotions and positive emotions. But you now see and learn how someone else managed that, how they regulated that, right? And you are able to impact that into your own life. You see how positively it impacts us if we engage socially. But what that means is if you don't engage socially and you isolate yourself, right, it also has the opposite. So what that means is you are put into a setting because you've not learned the appropriate social skills for different social settings, you don't know how to act, right? And then you feel awkward, you feel out of place, and that further reinforces you to want to hide. It further makes you want to run away from interacting with people, right? So you don't know what to do when someone says something to you that is disrespectful. You are not assertive, right? You are not able to, you are taking things more passive. And if it's not passive on that spectrum, you move straight to aggressive. You don't know how to stay in the middle ground, which is assertive, right? You move either way on the spectrum. But the more you interact, you're able to say, oh no, there are better ways to handle this, right? Either by asking questions, oh, how do you handle this? To get to problem solving. Or by observing people. Because naturally we are imitating, whether or not we agree with that. Okay? Then the last way it also impacts us is it heightens cognitive distortions. So with cognitive distortions, the other way to describe it, a simpler way to describe it is faulty thinking styles. So cognitive distortions are ways we think that are not true, essentially. And a simple example of those are, we mind read. So almost want to predict what someone else is thinking. So you did something and you start thinking, oh, is he sad? Is he angry at me? Oh, did I disappoint them? Maybe they're not happy with me, they're not pleased with me, they're dissatisfied with my reaction. It's now making you feel more tension, you are now becoming more cautious, in your interactions because of the cognitive distortions. And as a result of being isolated for too long, right? The more isolated the person feels, the more negative self-perception develops. So you know how we talked about earlier on, you are invited to something you don't show up for, but then people carry on with their lives as they naturally would, because people will carry on with their lives whether or not we like it, right? We now have to decide if they matter to us and we want to be a part of the different stages of their life. So someone invites you to their bridal shower, right? You don't show up for the bridal shower, or you don't show up for the wedding. Such a person may or may not invite you for a naming ceremony. Do you see how it cascades? And then you start thinking negative thoughts like, oh, people don't care about me, people don't love me, I'm unlovable. No, the actions are bringing those reactions. Okay, your initial actions is what's leading to this. Nothing new is coming out of the place, right? And with cognitive distortion, there's of course different types. There's the all or nothing thinking that can now come. Okay, so if they are not there for me, when I need them present in this very moment, then they must not love me. They must not care for me. And that reinforces itself negatively and of course can lead to, well, depression and even more mental health issues. Okay, so if you are someone who has ever struggled with bipolar, right, you understand how when you start having a negative thought is a warning sign that you have to pay attention to. Before you even start looking at other physical symptoms, okay, I'm sleeping too much, you look at what your mood is saying, what your thoughts are saying, okay, and how your behaviors are. If you're isolating a little too much and you're thinking negatively, you run into more arguments, okay, and the more you go into arguments, okay, it now forces you to isolate even further. So we have to be very, very careful of how loneliness affects our mental health and how we cope as a result of that.
Thank you very much, Judith. Another wonderful session. When I was doing my residency training in family medicine, I kept seeing patients over a number of years. I came to discover that there's always a psychological component of every disease or illness. And with time, I became more sensitive to emotional symptoms. In this part of the world, we somatize a lot. We rather present with something physical. I've seen expatriates, I've seen foreigners, they will just walk up to you and say, Doctor, I think I'm anxious. I think I'm feeling depressed. But typical African man may not tell you that. You may say, I'm feeling something crawling on my body, or I'm having one chest pain somewhere. I'm feeling that when I eat, I don't digest the food very well. All manner of symptoms that they might present with that you might not be able to find any pathological or physical cause, of those symptoms. And so I've found out that emotional symptoms have effect on our physical health, and our bodies in general. And so I think the slide before this, please, let me move to the slide before this. So, what are the physical effects of loneliness on our physical health? My dissertation was the relationship between cardiovascular risk factors and depression. You understand? And I was able to find a linear relationship, meaning that if one rises at the other end, the other will rise at the other end. What do I mean? The issue of depression can cause increased depression if you can grade depression. And I was able to use the PHQ-9 assessment form tool to do that. I discovered that the more depressed you were, the more your increase in cardiovascular risks like hypertension, diabetes. Because once you are depressed, you will not take care of yourself. There's an aspect of self-neglect when it comes to depression. So you don't mind what you are eating. You may not even take your medications. You may live anyhow, smoke, drink. You don't care anymore because you are depressed. And you probably even want to kill yourself, suicidal ideations and all of that. So that affects and increases, the level of cardiovascular risk factors. So it's been found that loneliness, which if not well attended to, could tilt anyone into depression, just like you just explained, can affect or cause heart diseases. Like I said, somebody is feeling lonely, and some negative hormones that are released, and all of that leads to oxidative stress, and all of that within the body. Chemicals are released. Moving to the next slide, what are the other effects, of loneliness? It can also result in increased rate of death. I'm going to read something to us. Can you move to the next slide? Sorry.
Okay.
Sorry. Still on that slide. Yes. So like I said, it can even cause dementia because, like I said, it increases the cardiovascular risks like stroke and all of that. And that will reduce blood flow, to the brain, and it can cause vascular dementia, especially if it affects the frontal lobe of the brain. And then you also have loss of cognitive function, because of that also. And then it can result in depression. We've said that extensively. Well, and then you can also be vulnerable to stress, just like I said, and that will lead to further isolation, and all of that. And then it increases the impact of loneliness, on your health. It also increases the impact of stress because if you have a community we are talking about today, you get enough support from people, definitely you feel supported, you feel you are not alone in whatever challenges you are going through, and the impact of the stress would have been reduced. But when there's no support, when there's no community, and you don't feel lonely, definitely the impact of the stress will be felt even the more. And then it can result in premature death. I saw something when preparing for this webinar. It was a paper submitted by the Surgeon General of the United States. It's titled Epidemic of Loneliness and Isolation. And he said this. He said that the mortality impact, that is, loneliness being able to cause death, the mortality impact. So if you look at different factors and measure their mortality impact, that is, this factor, how can it cause death, or how often, or how will I say it now? Probably, how can it lead to death? That's the mortality impact. So if you measure the mortality impact of being socially disconnected from people, which is loneliness, it is similar to that caused by smoking up to 15 cigarettes a day. And when you smoke up to 10 cigarettes a day, which makes one pack of cigarettes has 10 sticks of cigarette there, you only need 10 pack years to develop lung cancer. So if somebody smokes 10 sticks of cigarette every day for 10 years, definitely, most likely, will develop lung cancer. So you can imagine smoking 15 sticks of cigarette every day. The mortality impact of loneliness is higher than that caused by obesity. And obesity causes a lot of morbidity and mortality. It can result in hypertension, diabetes because of increased insulin resistance. It can result in cancers. A number of cancers are associated with obesity, arthritis, and all those diseases that obesity can cause. Loneliness the mortality impact of loneliness is even much higher than that. And then also other things, other diseases, they are little or small in terms of mortality impact compared to loneliness. And this is why we really need to address the issue of loneliness. For me, for example, I take care of the elderly, and it's a major component, one major health challenge of the elderly. Probably due to the Japa syndrome, like we say, a lot of people have gone out of the country. But the unfortunate thing is that you can't take your parents along. I have two patients that are citizens of the US, but they refuse to travel because they are tired of traveling. They prefer to stay home in Nigeria. One of them has been experiencing loneliness. I use that to describe what we call the thick file syndrome. If we're using case notes, a case note would have been so thick because she's always in the hospital every week. We've run investigations, she's seen me, she's seen other medical officers. I've told her from time to time, I don't think you have any, because all the results, we found that we're normal. But she will still come, I'm feeling this, I'm having bitter taste, I'm feeling cold, I think I have an infection, I have malaria. To prove that she's lonely, you know what she does every day? She'll get up and go to the market. She's not going to buy anything, just walk around the market and go back home. Just for her to interact with people, because she's the only one here. All the children are in the US. Her husband is in the US. And she's in her late 70s, So loneliness can really affect people's health, and that is probably why she's presenting with all those physical symptoms. Despite the fact that there's nothing really wrong, Fiona, thank you for that comment. Can we move to the next slide?
Because the goal of this session is really and truly to understand the impact of loneliness and how it's not something to joke with, right? It's not something to play with. It's not something to take for granted. It's very important that we pay attention to when we are lonely and what we need to do about it, right? And that's where community comes in. Okay, so community isn't just about being surrounded with people. I'm sure everyone, and even if you didn't join from the onset, we talked about loneliness and we talked about how it's really not about the quantity of people, but the quality of the interactions you have, right? The ability to really and truly feel connected to those that are around you, right? Those that you are around, okay, those that you spend time with, those that you communicate with. You feel seen by them, you feel heard by them. Yes, okay, thank you very much, Oluwagbemiga. I see the connection between loneliness, mental health, and the negligence of intentional communities, social and open spaces for interaction, and outdoor activities. Exactly, right? The loss of thought spaces, just so much has happened. So much has happened. Thank you very much for all the comments, right? Community is the quality of interactions, really. It's not just about having a group of 100, a group of 10 people, just hanging out. No, it's about the quality. It's about feeling belonging, right? I feel like I belong here. I feel safe here, right? I can be emotionally intimate here, right? I feel like there's shared purpose here. I can open up. I can open up about my struggles. I can talk about my needs and I can feel heard, right? Not like shoved to the side and whatnot, okay? And that's why community matters so much. It's huge. It's not something we can take for granted in any capacity. Now, it has first the biological need. And I know I expressed it earlier, right? About the biological need, about the fact that, loneliness, our social interactions, and our mental health, how they all align to, our biological basis. And the biological basis for social interaction, really and truly, is the fact that we have aspects to the being that we are, the humans that we are, the physical persons, right? The bodies that we are, right? Our body wants us to connect with people. That's just the truth. Our bodies are wired to help us connect with people, okay? And if we allow ourselves to be in such interactions, we'll strengthen those aspects to our brain, to the hormones that are being secreted, that will make us to continue doing that. And what does that mean? That means that if I'm in a social interaction, right, and I enjoy being there, I will want to do more of it, right? It reinforces me to show up even further, okay? Because I feel those happy moments, right? I feel those happy feelings about, oh, I interacted with someone for the first time in a long time. Okay, for example, Doctor mentioned like someone who he has lost touch with for a very long time. And he had a 5-hour chat with the person, and that's very interesting, right? Fiona mentioned when she was back in Nigeria for 2 weeks, she was able to connect, and that's the essential point, right? You now feel like you are aligned with people, and that's biological basis, right? It's a biological need because we are all social creatures, really and truly. And if we neglect that aspect to our lives, we are just going to be imbalanced, and that's just the fact, right? And community also is a stress reliever. Because let's think about it, you are going through a hard time, right? Rather than sitting down to think, let me tell you one funny thing that is happening. And I'm very sure we all, to some degree, are able to spot it now. So we all communicate with AI to some degree, right? Maybe you have something you're thinking about and you want to brainstorm with AI. But now people now use AI to stress relief as well. So it could be you're taking a walk and you're like, oh, I'm going through some things, and you discuss with AI, oh, this is what I'm doing, and it's helping you unravel those thoughts. Beautiful, it's able to do that, good, right? Not to negate the benefits of what technology has given to us, right? But then it's taking away something very vital. In the past, we just have a phone call to maybe a mom or your dad, or a friend, or an acquaintance. You have a phone call or a work colleague, and then talk about this thing that is stressing you, or just chat about something, and then you feel relief, you feel that stress relief from it. But now we've replaced it with something else. It's not to say, oh, villainize AI. No, it's to also understand that we can't replace certain things, right? As much as AI is here to stay, because that's something we all have to accept. It is here to stay, but our communities too should be here to stay. And we have to be intentional about making that possible. Okay? If we are to have that stress relief, from just chatting up, it could literally be, oh, your friends are not in the country, right? But you still love these people, right? You still want to have good relationships with them. Then you might have to schedule calls. Okay, schedule calls to catch up on each other's life. And it's something that when you start doing it, and of course, there are techniques to doing this, right? Techniques to doing this in the sense of you can have scheduled days in the week or scheduled days bi-weekly, right? And you decide what works best for you. And it provides you that human connection, that true interaction. Because I'm sure you all know when you interact with AI is kind of a yes man. Can we all be honest with that? So he agrees with you most of the time. Unless you tell it, you agree with me too much, tell me like another aspect of things, and then he starts looking at the other angle to things, right? But you have that human where the person is able to understand you in the context of your life, right? They understand you in the context of maybe you're a daughter to someone who was an abuser, right? Or maybe you are, you are someone who is currently going through a life transition, and you probably lost a pregnancy in the past, and you're seeking, support regarding that, and you want just someone to comfort you. AI cannot provide that support. Can we accept that? Can we accept that when the real hard times come, AI cannot support us in those ways? And we can't wait for those hard times for us to remember the community. We have to have the community through it all. So they're able to see us through the different phases. So you know how you have your family members, and your family members see you from birth, right? They see when you were sick, they see when you went to school, when you took your first steps, when you had your first words. Some friends will not see you through all of that. A lot of friends will not see you through all of that. But let those people who are around you, who you genuinely love and care for and want in your life, let them see you through the different phases of your growth. Okay? Let them be able to experience it with you, and you experience their growth as well, right? And it helps for that safety. Because safety, you can't buy safety, truly. You can't buy safety with speed, right? It's not something you say, oh, I know him, or we go to the same church, or we work in the same place and I feel safe with him all of a sudden. No, that's not how it works. It's by, oh, I've seen him through different stages, right? I've seen him through different contexts. So it could be, I've seen you in the workplace, I've seen you in different contexts, and I feel safe with you. I know the kind of person you are. I know how you deal with certain things. I feel aligned with the kind of purpose you are leading your life towards. And then we connect on that basis, right? Then another thing that is very, very important to note when we are thinking about our community is that it's so important simply because it's a protective factor for so many things. So when someone has suicidal ideation or a suicidal attempt, right, part of the intervention is safety planning. And safety planning is, identifying what the triggers were. You have the warning signs. What were the things that led you to this before, right? Then you now move on to the internal coping mechanisms. So what are the coping mechanisms the person had? And then you come to find out most of the coping mechanisms were typically negative, right? It could have been addictive, behaviors. It could have been, negative rumination. So that's the cognitive distortions we talked about earlier on, right? Then you now move on to things that can distract you. So things that, hobbies, things that you enjoy doing, right? And then people you are close to. So people who can provide distraction. Then you move on to people who you can ask for help. Then you move on to professionals who can ask for help. Now you see, from all these things I listed, right? When you have the warning sign, you're now trying to safety plan against, such a thing happening again, to make sure the person feels more prepared. In the case that they feel those negative thoughts arising, right? And they're isolated, they know what to do, right? They know the people to call. But if you don't have a community, who do you call? Who do you have in your safety plan? Now, can we all see how huge, how important it is that we have people that matter to us? And we can't always, let's not focus on only the downtimes, right? Even when you have great things happening for you, you want to share it with people that you love and people that love you. And having that community, it reinforces the thought of I am loved, I am seen. Because consciously or unconsciously, a lot of people operate from the cognitive core beliefs of being unloved, being unworthy. And those are things that trickle down into anxiety, trickle down into self-doubt, imposter syndrome, and so many other things. But your community are people who can ground you. You might be going through something, that you think you are the only one that is experiencing, and you share with someone, and the person's like, oh, I experienced that last week, and the person tells you about how they went through it. And you don't feel as isolated as you did in the beginning. It validates your experience. Do you see how important it is that you have community? And it's not just by surrounding yourself with people. Let's always remember that. It's about people that make you feel belonging. You make them feel belonging, right? People you connect deeply and truly with. You feel aligned with your purpose. So people who want to be better versions of themselves. They are constantly committed to growth and excellence in every capacity. You would easily merge with such people, but if you move with someone who doesn't align in, where they want to go, easily you will be disconnected, and that's not your community. And we can also be accepting of the fact that not everyone is our community, because our community has to be someone or people where we feel belonging, sense of belonging, safe with, shared purpose. Okay, it's important.
That was another wise and nice session. I always refer to you as the erudite psychologist, and I think you've proved that this morning. I hope you're enjoying the session. We'll soon be rounding up. We know we started about 30 minutes behind schedule, so we'll try to round up as quickly as we can. Please, if you have any questions or comments, you can put them in the chat box. Thank you very much. And so, just to have a recap, when you were talking about community and all of that, it made me remember the fact that we need to be intentional about building communities. I could remember a certain year, a certain school, calendar year, when my wife came together with some other mothers, with children. Most of us had children in the nursery school, which was some distance from the high school. And so what everybody does is that every morning you carry your children, drop them in school, then you move from primary school, you move to the high school before you start going to your office or going back home and all of that. And the women intentionally, they built a community. And so like 3 families, this mother will be the one to do that today, maybe on Monday, another mother, and that helped to relieve a lot of stress. So you have to intentionally build communities, support systems. You're a young couple, you just gave birth to a baby for the first time, definitely you won't be sleeping. For the next maybe 3 to 4 months, sleepless night and all of that. And if care is not taken, that could get to you, either of you, either the husband or the wife, it could get to you and strain your relationships and all of that, lead to loneliness and all of that. And some even get attracted to the newborn baby and then abandon their spouse and all of that. And so it just seems like I'm just producing these babies for you. You are interested in the babies and not interested in maybe the woman giving back to them and all of that. So you have to intentionally build communities. Our personalities too can affect how we can cope with loneliness. So you have to be intentionally friendly. Be a friendly person too. Don't be someone that is easily highly irritable. People can't relate with you. You are very difficult. If you keep behaving that way, then everybody will walk away from you.